We are from Hampshire Care Council, and one of our priorities was reducing stigma for children in care.
Kids can go into care for many different reasons. These include families who have problems,
Abuse, neglect or risk of neglect,
drug and alcohol misuse,
families who are in crisis,
families who can't provide for their children or their needs,
parent illness,
a loss of a parent,
and parents unavailable at present, such as going to prison or hospital. Children can be taken away in the middle of the night for their own safety.
It can be decided through a court process that children need to go into care.
Social workers will work with families and, if needed, support with court proceedings.
I think there needs to be more education for teachers and professionals on how children in care feel, which in turn will support them to reduce the stigma that they may receive in schools and outside of schools as well.
School can be quite overwhelming for children in care.
I have faced personal stigmas in schools such as harassment, a lack of empathy, loads of assumptions,
bullying, harassment, gossip,
that no one loves me, people understand what I've been through when they don't.
taking the mick out of,
having comments made such as "you don't have any parents," "where are your parents," "no one loves you." As a council, we have discussed options on how stigma could be reduced in schools, and these were our findings.
I would personally reduce stigma in schools by having more staff meetings,
Making sure that you have all your staff looped in and what that plan is for that child that's fresh come in, making sure that all records and history is updated, making sure that they get assessed of what they're good at, their strengths and their weaknesses.
judging your ability to learn, so not just putting you in the bottom set, but maybe doing like a little test in the beginning when you first go and say, actually, what do you struggle with, what don't you struggle with, because they don't always know your struggles.
You need to have a good support system and making sure that they have that around them and that they know who they can go to.
More one-to-ones for the children to understand they're not alone.
Having a safe space that we can go to maybe at lunchtime, or having a pass that we can take out in lessons, like I need a 5-minute break from class.
And if they need to take that time out, then they can go to a certain space and take that breathing time and then go back to lessons so they don't miss anything. And if they have missed stuff, obviously making sure that the teacher informs them on what they've missed.
If they've got to miss lessons for meetings or social workers that come into school, then maybe allowing them to have a catch up.
Making sure the teachers are aware of certain things as well as certain triggers, making sure that they also have a lot more counsellors and more trained staff that are trained in certain things like PTSD and other mental health issues.
If I was a head teacher in the school to change the stigma, it'd be helping care people just to actually get them to settle into school so they can have a bit more fun.